Hello guys, good morning and welcome back to my channel. In this video we are going to discuss about the skin diseases of the newborn, like newborn pemphigus, vesiculopustulosis, pseudofurunculosis, and about the jaundice. We'll talk about the jaundice, like pathological jaundice, physiological jaundice, when do they occur and how to solve those problems. So let's start. Bone skin diseases, in which the first case says about the neonatal pemphigus. So let's see the question directly. A mother of the newborn child suffers from the chronic pyelonephritis. She had acute respiratory viral disease before the labor, erythematous eruption, seropurulent vesicles, erosions, and vesicle rupture quickly. So remember in the question about the redness patches, first of all there will be erythematous eruption will be there, then there will be seropurulent vesicles, then there will be erosion after the ruptures. So when the vesicle rupture, or when the question said the vesicle ruptures quickly along with the Nikolsky positive sign. Nikolsky positive sign means easily peeling of the skin. So then at that time you have to mark the newborn pemphigus, Pemphigus neonatrum, Impetigo neonatrum. They are all the same names. Let's see one more case over it. Another question says about the vesicle rupture quickly. So it's the same case, flaccid vesicles, purulent contents on the chest and abdomen. So it's the same case about the neonatal pemphigus. Let's see the next is vesiculopustulosis. Vesiculopustulosis, in this case we are going to see seropurulent content in the occiput region, neck region, and buttock region. I have highlighted the buttocks here so that you do not forget about this, that in the case of vesiculopustulosis there will be rash in the occiput, neck, and buttock will be given in the question. And you can see more seropurulent fluid. Let's go next. Next is the case of pseudofurunculosis. So in the cases of pseudofurunculosis, so first of all it will mention the scalp. The scalp will be there because furuncles are there, so we can misdiagnose furunculosis or pseudofurunculosis also in the scalp itself. So red subcutaneous nodules. So when the size of the nodules is given, you are going to mark the pseudofurunculosis. Although the CBC shows the anemia, leukocytosis because of infection, accelerated ESR, neutrophilia. So I hope you will remember this. Next is a case of exfoliative dermatitis. So exfoliative dermatitis is a streptococcal scale infection. So it's the same profile as neonatal pemphigus, like erythema, vesicles, erosion, cracks. So 5-day-year-old Nikolsky positive, it's very similar profile. So do not mug up with the neonatal pemphigus. This question says about the peeling of epidermis especially. So when it says about peeling of epidermis, it is exfoliative dermatitis. Now these were the cases for the children. Now there is a case in the same video that the same case, like vesicles, erosion, torso and limbs, and Nikolsky is positive. I have mentioned here what is Nikolsky, easily peeling of the skin. So this is adult case. So when you see the same things like neonatal pemphigus, Nikolsky positive, and all those symptoms with the adult case, that time you have to mark the acantholytic pemphigus. Acantholytic pemphigus. So next is jaundice. Jaundice, we all know what is jaundice. Here are the symptoms, like yellowing of the skin. Jaundice is characterized by hyperbilirubinemia, as you know that yellow ecteric skin, in the question they will say. So pathological jaundice will occur on the first day, and physiological jaundice will occur later on the second or the third day. So you can remember it this way, that when the baby will deliver, when the baby will see the earth for the first time, he is going to meet the bacteria first of all, the smallest living organism. So on the first day pathology will be there, and after that on the third day followed by the physiological jaundice. So you can see the symptoms of jaundice here. Main symptom is yellowing of the skin and eyes, and dark urine, fatigue, itchiness. Fatigue will be in a lot of things. Let's see. So the first question highlights about the teenager: weakness, dizziness, heaviness in the left subcostal region, and visible mucosa are ecteric. Lower edge of the spleen is at the level of the navel. So I got the highlighting word here, that the problem is in pre-hepatic yet. The problem hasn't even reached to the liver yet. First the problem is in the spleen, then it will go to the liver, right? So the problem is pre-hepatic. The lower edge of the spleen is hugely enlarged. The spleen is very diffusively enlarged, that it is up to the level of the navel. So the problem is pre-hepatic. So we will see the increase in the unconjugated bilirubins. Next is the baby developed jaundice on the third day. I have told you that this is the case of physiological jaundice. This is infectious mononucleosis. Infectious mononucleosis is also known as kissing disease. So it's a viral infection commonly caused by the Epstein-Barr virus. As I have wrote here, the maculopapular rash you are going to see in the question. Let's see the symptoms highlighting it. So in the questions you are going to see main symptoms as tonsillitis for sure will be given in the question, like sore throat or tonsillitis or something like this. And a lot of group nodes can be enlarged, like some group or a lot of group of lymph nodes can be given enlarged in the question. Also you can see splenomegaly and hepatomegaly. Headache can be in a lot of conditions. Fever, or let's say the asthenovegetative syndrome you are going to see in the questions of the infectious mononucleosis. So let's see some case. In the case says the patient have the asthenovegetative syndrome, sore throat, atypical lymphocytosis, enlargement of all group of lymph nodes, hepatomegaly, splenomegaly. So now we understand the profile of the question, right? That tonsillitis is given, asthenovegetative syndrome is given, and a group of lymph nodes are enlarged, hepatomegaly, splenomegaly. In the next question is also similar. The fever and asthenovegetative syndrome and the sore throat is given, and all the group of lymph nodes are enlarged. The lymph node size is given. They are slightly painful lymph nodes that do not match together. Purulent plague because of infection, and leukocytosis because of infection. So it is case of infectious mononucleosis. Another case is there in which the question highlights the maculopapular rash. So just so you know, I have highlighted it in the definition part itself. So you will remember it now after seeing this. So asthenovegetative syndrome, flu-like symptoms. Sore throat is there, enlarged cervical and some mandibular lymph nodes are there, and tonsillitis, they have said white plague because of the infection. So hepatomegaly and splenomegaly. So you will understand the profile of infectious mononucleosis after this video. So this is it with this video. I hope you will remember these pathologies are a bit tricky in the croc exams. So I hope you will remember them. This is it with this video. Have a nice day. Wait for the next video.